HIV/AIDS prevalences and incidences are highest in that population. The pregnancy, if you go to our antenatal clinics, some counties have 33% of their ANC visits are under 18. This is not acceptable. And these are people who have not planned to have that pregnancy. And therefore, what do we do? COVID was a blessing and also a challenge. A blessing because it has taught us how resilient our health system can be and how we can strengthen. We've learned a lot of lessons. It brought out issues that we used to put under the rug, under the carpet. That's mental health and adolescent health and SGBV. These are issues that we've been looking away from, and these are issues that are top priority now, and we want to encourage the counties to look at them. Maternal health and child health is still our top priority, but we've covered mileage. We've covered grounds. The free maternity was a blessing. Our skilled birth attendant has increased, although our maternal mortality ratio has not moved. But this is not to discourage us, because what we measure is 7 years down the line. Maybe the next census we will get a better figure. Having said that, the coverage has improved, but what is it that is still not yet improved? The quality of care that we give is what actually brings us the results that we want in terms of reduction of maternal mortality, child mortality, and neonatal mortality. The neonatal mortality constitutes 2/3 of our infant mortality. And therefore, that's where we need to focus on as a nation. Our mothers are getting saved. We're providing health services. We have the resources in the counties. The little resources that we have can help us achieve a lot of results, better results than we have. And therefore, adolescent pregnancy, it is one of the major 3 threats that we have: HIV/AIDS, GBV, and teen pregnancy. So when a teenager becomes pregnant, the cascade of events are catastrophic, and therefore we will urge, as at national level we are trying to prioritize it and resource mobilize for it, but at the county level the impact can be much more evident because you are closer, and the resources are also much more in the counties than at the national level. I'll stop at that unless you want to ask further questions. Thank you.
Thank you very much, Dr. I think quite rich information there on policy co-creation stands out, and that things have changed. I think that's good news for people in this room to understand that. And also on the care issues of quality, and just the situation and statistics that we have. And with that, on that quality note, I want to come to you, Samora. Dr. You've been in this field for quite some time, providing technical assistance to government, county governments, and now through IQVIA. What do you see as gaps? What gaps exist in service delivery? What do we need to sell? What do we need to do differently? And as you respond to that, if you can just probably also talk a little bit about the opportunity that we have, that is technology, and how we can use technology to exploit and improve service delivery.
Thanks so much, Dr. A couple of things. I think on the question of what the key gaps is, I want to pick on from the colleague who was here earlier on. And I think the main thing is asking ourselves, is the service good enough for us? Okay? And if we get to that point where we feel, and if we get that mentality that actually it needs to be good enough for us, then we are starting to have the right conversation. And I say this because, let me just give an example. Very sort of recent case. So colleagues in the health sector, maybe some of us would know, we recently lost a colleague. The colleague had an acute incident, but it happened that the only place he could access care was in Nairobi. And unfortunately, he couldn't make it to Nairobi. And I use this as an example to say, and maybe what we are looking at in this case was more of an advanced care. But oftentimes, a lot of us, as has been shown again here, we have access to, healthcare, maybe advanced healthcare in the private facilities, and we only go to the public facilities to visit our relatives, or maybe take our relatives or visit or take them to the hospital. But then, oftentimes, because we are constantly traveling, and especially colleagues here, waziris, you'll be traveling to some of the most remote places in your counties. And you never know, God forbid, you get somewhere and you're involved in a road traffic accident. That initial care is what actually saves your life. You can only, you access to Nairobi Hospital, you access to, I don't know, the private hospitals in the county headquarters only matters if you get there alive in the first place. So there's a bit about just personalizing health and thinking about it from, if I needed this health in this facility, would I be able to get it? So I just want us, I think, the first thing that we need to think about is just having that challenge about, make it personal about, is it good enough for me? And then that would help. Now, in the work that we've been doing as IQVIA, we are currently implementing a project that's funded by the World Bank. We are supporting 11 ASAL counties, and the idea behind the project that we're doing is to support public health financing at the primary healthcare level. And so, there's a risk, of course, when you talk about UHC, that it gets oversimplified and UHC becomes, if we sort the finances and everything is sorted. And so I think I just want to put that caveat that that's a risk. There's much more to UHC than just financing. But having said that, we know also that financing is a very important part of that. And I know throughout these last couple of days, a lot of financing has been spoken about. And I just want to talk a bit about some insights that we've seen, again, targeting that financing, but again, with that caveat that financing in itself is not the end. It's not the be-all and end-all. There's more to it than just the finance, but it's definitely very important for us to get the finances. We've talked about, how much money we get, and so according to the World Health Organization, they feel that, and especially in a devolved context like ours, maybe, and World Bank studies as well, they're thinking that we should maybe allocate about 30% of our budget. I mean, of course, it depends from county to county, but on average, we think about 30% of the county budget should go to health. A lot of our counties are struggling. The best performing ones are, I think, at about 25%. A lot more are actually struggling with that. And so that's something that we need to think about. How do we increase that? And I'll give some suggestions about how we think from the conversations that we've had so far with the counties and just from the work that we've done, how that can be sorted. But then there's a bigger question. Even that 30% or 25% when we get it, and how much of that is getting allocated? And there's a big conversation now about we need to move away from the more expensive curative work to more preventive and promotive work. Currently, counties are struggling to get to 10%. So currently about only 10%, and those are the better performing counties, are actually allocating, the best performing counties are allocating about 10% of their budget, of their health budget, to primary health care. A lot of the money, of course, goes into infrastructure and maybe the salaries. And so there's also something there about, ultimately, what we'll need to do is maybe shift more towards that preventive space and invest more in the primary healthcare facilities. The other thing that we've seen is, and when we've talked a lot about this, that the need to increase. So clearly with this struggle, and we know counties are struggling with this allocation, 20%, even the ones who've gotten 25%, you get, sometimes you talk to them and they're like, actually that's as far as it can go because there's just so much competing interest. And so there's a question of how do we then think about getting resources beyond just what the county is allocating, and then you start thinking about on-source revenue, and of course the most easy one from our health facilities, from the public sector at least, is the NHIF conversation. And I know we've had a lot of said about NHIF. Two things that stand out. One is, actually three things. One is on empanelment. So in a lot of the areas that we are working, only 50% of the facilities are empaneled. Unless you're empaneled or registered by NHIF, you're not even able to make any claims. So only 50%, a lot of work needs to be done there. The second thing is, even amongst those 50% that are empaneled, very few of them are actually able to do the claims and doing them on time. So again, there's something there about how can we do more to just ensure that we are getting claims. The good examples that we've seen are counties that have actually dedicated people to do that. So you have like a coordinator or somebody whose role is just managing the NHIF claims, and that has really been very positive. In a lot of the counties, you have the nurse or the clinician who's supposed to be seeing patients and then somehow filling the NHIF forms. And what we've seen is just that doesn't work. And then the last one is also looking at just understanding the sort of the full package of NHIF and making sure that you're actually optimizing on that. An example that we've been discussing with colleagues is, for instance, the Linda Mama package. it's quite a comprehensive one. It covers actually all the way from A and C to P and C and covers the child for a while, the baby for a while. But a lot of us are only focusing on the delivery bit. So there's a lot that you miss out. You know, this mother who's already registered and Malinda Mama for us to access those services. And then the last point that I think is also important to mention on this, and this is a bit of, we need to have a bit of a private sector mindset in the work that we are doing and ask ourselves, are we really optimizing on all our resource avenues? And all you have is a consultation, go outside, do the lab, go outside, do your radiology, go outside somewhere, and then go and buy the medicine there. And all these are sort of potential revenue opportunities that we are missing out. I was speaking to a colleague, I forget which county it was, and they were just saying how radiology, I think it's also Dr. Eda here, who was saying that radiology is actually now their highest earning sort of unit as far as revenue generation. So we also need to think about it from that perspective of, you know, how then do we also maximize? Because there's a lot of opportunities that we are missing there. And then on the question of technology, if I may, when you talk technology, there's always a tendency to think, you know, high tech and, you know, we are going digital. But in a lot of the areas that we've seen, I think it's worth remembering that when you talk technology, let's think basic, you know, coming down on the examples that I've given, they're not able to claim NHIF because they lack basic computers, they lack basic printers. So even as we think about technology, there are some of these basic ones that will help us do the work that we want to do, you know, get our resources and get the work done. And then once we're done with that, then now we can start thinking about, okay, but what is the next level technology? Earlier on, we talked about, you know, how do we work collectively within the region? For instance, how do we work around consultancy work, and how do we make sure that we leverage on the resources that we have? And, you know, there's enough technology, for instance, to say if County X has neighboring County Y, for instance, and one has technology, has like, you know, a senior consultant, let's say a radiologist, then why can't we just say that we'll have an arrangement where the other counties that don't have that that capacity will just be sending their samples to be or their reports to be read on one side, and then we get that sent, so that we also have a bit of, okay, between our 3 counties, you focus on building this capacity, you focus on building a different capacity, and we focus on building a different capacity, so we see how we can maximize on the lead resources that we have, because it's going to be a struggle to expect every county to be exactly at the same level as each other. Thanks so much.
Yeah, thank you very much, Samora, for that. And I think you brought in quite some interesting perspectives there and practical perspectives. And I want to move to Waziri Robert with that in terms of, we've been talking about several things. We've been talking about primary health care, which Samora just very well articulates there, as well as several other things. Esther was here talking about us being able to pay for the commodities we have. But we also understand that counties have quite some limited physical space currently, with most counties allocating up to 30% and even beyond on health. So what advice do you have for us? How do we make health good? How do we deliver on these mandates of primary health services? How do we deliver on the dreams that this team has been making, even within this limited financial space? And as you respond to that, probably you can also mention 1 or 2 things around stakeholder management. How do we work with development partners, private sector, and other people to foster results within our counties?
Okay, thank you. I just want to share a bit of experience. I have worked with the county government of Nyeri, with 4 governors. I'm now on the 5th administration. And I wouldn't say it is very hard. It's possible to do some of these things, but I think it just calls for a bit of commitment and professionalism and humbleness in the whole thing, and you'll be able to get there. I think I also want to remove that notion that CECs finance are super ministers. I have been one, and I've been approachable, and we have been working with my team. So that team spirit is very important. Basically, finance is guided by the law. And I want to urge my colleagues here to take time and go through the Public Finance and Management Act. That is very critical for us because it is the Bible that the CEC finance will use all the time. And you'll have to engage with him or her, whether you like it or not, because I think that is the only docket that will be able to serve everybody, and that is where the resources are channeled through, and the law empowers the CCM finance. It is not his or her own wish. But I don't want to defend anybody, but just take advantage of that law and see the opportunities that they are in. I have been seated in this room and I was hearing about the issue of FIF. If you go to section 116 of the PFM, the CCM finance has the room to create funds, creation of funds, because that is his role. So take time to read that, make a proposal to him, have a sitting with him or her, and propose on how you would want to ring-fence the resources. Section 116 has that window to open and allow you to create a fund, and you ring-fence the resource, the revenue that you're collecting, and you spend at source. I remember the control budget approved ours on the 21st of June, 2021. So it is doable. It is doable. And then when you go down, you'll also see the sections that don't allow you to create that fund, including section 197. The other thing I wanted to mention, especially on that, just to put the importance of reading that document and internalizing, is the issue of emergencies. There is a tendency for health to call everything emergencies. When you go to finance, that's a different story. There is a separation between emergencies and disasters. So you have to categorize your issues in a very professional way and know that it is, again, anchored into the PFM. If you go to section 110, definition of emergency is very complicated because they talk about it was urgent, it was unforeseen. So we ask ourselves, was COVID foreseen? The answer is yes. Ilianza China. So it's not a new thing. Were fall armworms emergencies? The answer is no. They were spotted in Latin America, and we knew about the speed at which they would move and how many eggs they would lay. So it's a question of internalizing the law and executing it and working as a team. I want to urge my colleagues, because resources will never be enough, to get into a culture of resource mobilization. One of them is engaging with partners and also strengthening the revenue unit or directorate so that it is not seen to be a one department issue. Because once you have your own source revenue enhanced, then you have a high chance of getting an assurance that your CRF account will always be healthy, because the disbursements we get from the National Treasury are very erratic, unreliable, and inadequate. I wanted to also share some issues, especially on better coordinating partners and stakeholders in the county. And admittedly, the health is diverse and dynamic. So we need strong partnerships, we need collaboration and goodwill between government and other actors, because this is paramount for successful implementation of policies, strategies, and plans. And I recommend the following. One is, let us develop a partner engagement framework. A partner engagement framework, that is critical, so that we're able to engage with the partners without challenges. The other one is, I would also recommend that we do what we call the annual mapping at least to identify the county partners, their scope, their roles, and the level of funding. Then we share work plans and ensure that when we are doing our budgets, then we incorporate these partners in line. The other one is partners or stakeholders, liaison office in the county departments of health. I think liaison is very key because you have to coordinate, you have to work with these people, you have to talk to them, you have to listen to them, you have to approach them. And if you don't have a liaison office, then there is usually a very big gap that will be difficult to fill. Then, where possible, an annual stakeholders forum to take stock of what the partners are doing. I think during the presentations, we had overlaps, we had partners who are working, almost doing similar things within the same thing. You will not realize this until you engage in such forums. Then finally is allow the partners to participate in the county level planning activities, including the development of key policies and legislations, because you will not work in isolation. Right now we have an opportunity up to the month of March to develop the third generation county integrated development plan, take advantage of the partners that we have so that you bring them on board so that in future budgets where you'll be pulling out the annual development plans from the CIDP, you'll not have omitted any of this. So I felt I should share that and tie that to the role I have in finance. Thank you.
Thank you very much. And you can hear it. You have to work with finance, you like it or not, whether you like it or not. So thanks very much. I think that's very clear and very, very helpful in terms of fronting the agenda. And Nyeri has had some very good successes that we don't have time to share here. And I want to get to Dr. Eda with this. Hearing all this from the panel and having gone through this forum, we have a lot of aspirations for health. And you've chaired the caucus on health for CECs. We are talking about universal health coverage. We are talking about bettering the health of our people. What insights do you have for CECs here today? What insights do you have for us in terms of how the caucus can help us drive forward the health agenda, the UHC agenda? What do we need to do differently?
Thank you very much. I will look at what you have asked from a 4-point perspective. And point number 1 is about leadership. For all of us, the county executives who are in this room, out of 1 million or 200 million or hundreds of thousands of people who are in each county, God has given us the opportunity as one person out of the million to lead the health docket. So the first thing is each one of us must know that there is a very serious responsibility that comes with that, in which you are supposed to be accountable to the governor that, you know, has confidence and picked you out of 1 million, a responsibility to the people in that county that you are going to better their lives, and a responsibility in front of God that we say, I believe both Christians and Muslims share this, that one day, one time, each one of us will account for what you have done when you are holding some position of leadership. So when that becomes the driving factor, then you lead a team. You must have the drive. UHC is a journey that has, you know, Kenya has begun a very long time ago. We are not starting from zero. At the national level, the president is committed to make sure that Kenya's Vision 2030 is attained. At the Council of Governors, the governors are on board the same, but the CEC is the driver. And you know, it is said in English that one lion that leads 100 sheep is better than 100 lions being led by one sheep. And therefore, number one, we take responsibility of steering health in our respective countries for the next 5 years. This is number one. Number two, we must do what you call disruptive management. Disruptive management is you don't do everything the way it has been done. Every day you do the same thing in and out, you know. So we try something new. We have been, you know, the first 10 years of devolution has been about brick and mortar, building infrastructure, bringing in equipment, bringing in human resource. Every county is somewhere good. It is now time to think, what is next? And for me, what is next is primary healthcare and UHC. That should be the agenda that divides the next 5 years. That should be where we should all be focusing. And we ask ourselves then, what does this entail? What does, you know, focusing on primary healthcare entail? We have talked about the fact that 1 shilling investment in promotive and preventive health has got a return of 8 shillings, you know. And this is one area that, again, I want us to focus. The third aspect is finance. You see, my brothers, as you come in and settle, resource is everything. And resource, I'm talking about financial resource, human resource, but more important, let me focus on money. When my brother here was doing some presentation earlier on, I picked up on a graph that was showing what is the percentage of every county in terms of budgetary allocation to health. And when I saw my county was actually coming around number 4 in terms of budgetary allocation, and I seriously zeroed in, and it was showing somewhere around 20. I know it is 24. The first thing that I did was I took a photo of it and sent to His Excellency the Governor and the CC Finance. It's just a statement that, you know, I will elaborate on it when we meet with them at some point, making budget. So number one, lobby for more resources, directly, indirectly, whatever that you know you can do. 2, please seal all the loopholes of pilferage and leakage of revenue that is already there. Whether that money is your own budgetary allocation to sub-programs of the ministry, whether that money is donor partners that comes to you, whether it is money that's coming from NHIF, you need every shilling. So we need to lock out every single place that leaks revenue. Then number 3, we have got, you know, NHIF. I don't want to belabor this. I want us, the next 5 years, we are not going to talk about, we have heard from NHIF that we are given 1 million, and 1 million indigents to register. And 30% of those indigents have not been registered. It's not failure on NHIF, it is on us. We'll make sure every health center, every dispensary is empaneled. We'll take responsibility for every person that is supposed to be, you know, onboarded, to be onboarded. And we also need to prepare. We have just been told, please prepare that there's a budget of 9 billion. So as you go back, looking for the vulnerable people with all their data, then put it ready in an Excel sheet. You have officers down. And the moment NHIF says, okay, County X is going to get 10,000, you put the 10,000 day one. There's no need of going around beating about the bush. Those are some of the areas that I want us to focus on in terms of making sure then that we have got a dream that needs to be fulfilled. Finally, and this is very important, collaboration between the county governments and the national government. We know our governors and the president are working very well. We are going to make sure that this third generation of the CCs are going to work more closely with Ministry of Health and Development partners. We remove that thing where, you know, we talking to, you know, we need that dialogue. We need that give and take. We should not seem to be competing. We need to be collaborative. And that is, you know, at that level. Within the county, there are a lot of problems that you're going to find in health. And it is not, health is not the problem that caused it in the first place. Last night at 10 a.m., I have got what we call county emergency forums, which many of us, and I usually am a member, just to make sure that it's managers only, sub-county managers and the county managers, all of us are in that emergency forum. Anything happens somewhere in that county, then it is put in that forum. I don't wait for information to come to me from the chief officer. So if a nurse manager at some point, a sub-county, let's say DPHN, has posted, I have got first-hand information. Last night, and this is what I want to talk about collaboration. At 9:45 p.m., when I opened the county emergency forum, in a place, a faraway place called Finno, that is one of the most insecure small town, you know, in Mandera County. Dr. Bashir knows, we come from the same place. They reported that we have had today about 20 cases of diarrheal diseases in children and women. And so immediately, because the county has been on red alert for cholera, our neighbors, Wajir, Garissa, Nairobi, where, you know, every day there's a flight from Nairobi to Mandera, we have been on alert. So immediately, we took a collaborative decision. I tasked the public health team to make sure that things have already been prepositioned. So it is just to know what exactly is causing. Collect stool samples, do rapid cholera test. And it is not going to be done tomorrow. You do it tonight because we have got a team stationed in that sub-county. Then I called my colleague who is the CC for water. Because after all, that cholera comes from what you ingest. It doesn't come from the hospitals. So please, there must be something in the water. Now we are talking about diarrheal disease. I don't know what it is. But the first thing that I want you to do is to make sure your team goes and empties out the water tanks that the public is using in that town. All the water tanks the Ministry of Water has installed, empty it be cleaned, and please pour in chlorinated water. And by this morning, that has already been done before I came here. Both teams, set of teams, are working together. And this is what you call, you know, horizontal collaboration between teams. Sometimes you get problems from another department impacting you. And unless you talk to your colleague, unless you work collaboratively, then you can end up in a situation where you cannot manage. Thank you very much.
Very much, and really practical issues there. As you know, health, as we said, you can receive things from outside. So I'll come down, and because of time, in the interest of time, I think I'll only take 3 questions. We have 4 rows. So the first 3 hands up will take those. So I'm looking here. But this group wants to pass. Yes. So we'll take a question here.
All right, thank you very much. I'm called Dr. Sirma, Baringo County, and my question goes to Dr. Bashir about the adolescent's pregnancy. I don't know how far, or is there a policy you are preparing in order for the adolescents to use contraception? Thank you.
Thank you very much. Let's ask just the question like that.
Thank you so much. The other day, Dr. Bashir, thank you so much for the contribution. The other day, I was called by my first lady. She wanted to know our FGM, how we are doing in the county. And I realized, as I was moving around, I realized we don't have a register for the same. Actually, as I'm talking, we've already instituted so that together with other partners who are working around. Do we have the same at the national level? And what are we doing in order to support that?
Thank you very much. So I think that's Dr. Bashir, right? Okay. So this group, so we have 2 questions already taken up.
Thank you. Mine is not a question, it's just a general comment. My name is Cyril Oyongo, the County Attorney Bungoma. This ties to the earlier presentation by my colleague Eugene Lawi on the management of human resources for health. And I wanted just to make a general comment, maybe for the consumption of the CCs who are here. I've seen a practice where in specialized agencies or professionals like yourself, when you're talking about human resource management, you have a bias to focusing only on them, for example, if it's health, on medical personnel. And you realize that for you to achieve results, you will have challenges if you do not also focus on the other support staff. especially procurement, finance, human resources, and even logistics, drivers and the rest. So much that when sometimes you even budget, when you're doing training plans, when you're doing any promotional or anything to do with human resource, your focus is about doctors, nurses, and all the medics only. That may be good because that is primarily your area. But then when you do not have the other supporting staff fully integrated in your management system and fully supported to be able to help you, that's why you will have a challenge. You have money, but you can't get drugs because the procurement guys do not support you in the procurement process. You have, for example, human resource issues because under human resource, you have people who manage your trainings, the people who manage your leave days, your people who manage the whole aspect of human resource, including the soft skills about the human resource. So the challenge is maybe as you go back as CECs, as you focus in managing your units, remember you are not working in isolation. Have a way of also integrating your support staff so that they can be able to help you deliver better, especially the human resource, because I've seen a lot of challenges. Because if you have a nurse whose work is to run from morning to evening about her payroll number, missing details, then she does not deliver on her core mandate because someone who is dealing with human resource then is not fully doing their work. Thank you. That's what I wanted to say.
Thank you very much. So I think Waziris, we have two Waziris there. If you can make a comment on that. The issue of a nurse going to pick commodities and leaving the dispensary closed.
Okay, my question goes to Dr. Bashir and Dr. Samora. I can also chip in on this. We have noticed that the vertical programs have created parallel systems. Talking about HIV, TB. Is it time now we start thinking about integrating services as also one of the ways of just for sustainability? Is it feasible at this particular time? I know all of us are talking about the donor society wedding up. So could this be an option?
Thank you very much. I come to this third row, and already we have one hand up. We have two, so I think we are set. Just the question kindly because of time.
Thank you very much. My name is Franz Dwiga, CC Health, Embu County. I would like to take this to Dr. Bashir. I know you have a big department and components that you really support us. One is the nutrition component, which is coming up as one of the key emerging issues in our counties. What are you doing to really see how we can also be able to focus on nutrition as one of the key components in our county level?
Thank you very much. Waziri, go ahead.
Yeah, thank you. Wanjala Pepela, Waziri Trans Nzoia. Mine is from the Waziri from Nyeri. In terms of investments in health, we have 8 key investments that as a sector we do planning. What is your experience in terms of the investments in these building blocks so that each one of them are running? Otherwise, it will still be a challenge if we only invest 70% in human resource, maybe 20% in HPT, and then the rest we are not investing.
Thank you very much. Waziri Pepela.
Okay, thank you. My name is Albert Taiti, CCM Health in Laikipia. Maybe the first thing, which is more of a comment, but I would also want to hear, is following the issue of, I know there is a colleague who has talked about engaging even other health cadres. And I'm still following on the same, especially the technical officers, because even in specialty, we keep on referring to specialty at a consultant level. We have even so many other cadres, and more so the clinical officers who are offering specialty in most of our facilities today. Many patients will either get well or die before they see the face of a doctor. So I think that is something we need to think about and think how they can be able to benefit. Of course, the other issue is the issue of mental health with our adolescents and the youth. Like in Laikipia, it has been an issue. And I would want to hear from Dr. Bashir how they are trying to do this, because the youth are a very special group. And even their mental health issues are rising mainly from drugs and their lifestyle. Thank you.
Thank you very much for the question and comment. We come to the last group, and I can see 2 hands already.
Yeah, thank you very much, panel. My comment goes to Robert. Many of you may not know that Robert there is not even a finance guy, and he has been a very successful finance minister. And he's also not a health guy, but now he's in health. And yesterday we heard that there are a number of counties which have had FIF regulations or acts done, but they cannot work. I suspect that they were done without the involvement of the CEC Finance. PFM Act is very clear. It is the CEC Finance who is allowed to create the fund, not even health. So if you are a CEC Health, you are struggling to make the regulation FIF, it will not work. The law does not give you that mandate. Maybe you can confirm that, Dr. Robert. Thank you.
So Waziri, a question for you to make.
Thank you. My name is Boniface Mbudia from Thinkwell, and I just want to make a contribution to encourage Waziris that if you compare this year and 2013, counties have more money, counties have more healthcare workers, and counties have more health facilities. So the missing link is how to ensure all these resources result to additional, better, and more effective services. And I think that should be the focus for our third season of county governments. How well will we ensure that the resources we already have give us the best of health service delivery so that we can have more mothers delivering, etc. The second thing that is also important is how to ensure that we can optimize all these resources that we have. It would be unfortunate if we have 1,000 workers and only 50%, for example, report to work. And so sometimes we find these absenteeism reports are being published but are not being acted on. And so I would really encourage you that the different reports that will come out about service delivery across the country, please take action, because they're actually speaking to the resources that you have, and that will help you to be able to optimize service delivery.
Thank you very much, Boniface. I'll now go back to my panel, and I'll start with Dr. Bashir. Let's be just brief. Choose one question or two that you've been asked, and kindly respond to it. We are a bit pressed with time. Thank you. Dr. Ali.
Thank you, Wamalwa. The question of SRH policy and the contraception for adolescents. Yes, we have a policy that is almost being concluded, and it's the COG and also the previous chair of the CEC Health Caucus were members, and I think he resigned and went into politics. But that space is still there. We were supposed to have concluded it this week. Unfortunately, the DGs, who was the chair, had other social engagements, which you could not, so we postponed it. But we are in the final stage of the adolescent and young persons' sexual reproductive health policy. In that policy, we are guided by the Constitution, and we also have the religious associations, the CKRC, the Interreligious Council, plus also the Parents Association. So we are very, keen on our culture, our religion, our Constitution, There are places that we will not allow. There are people who are pushing for the under 10 or 10-year-old to have contraceptive, but that we cannot allow at this time. But there are adolescents who are empowered adolescents who are married, adolescents who are head of families already, and there are a lot of families that have been left by, that are being led by adolescents because of HIV/AIDS and because of orphanage and many other things. So there are exceptions, but it's not a blanket for them. 17, 18-year-old who is a mother already, yeah, we can look at it. And then there is parental consent, which we have put in there. But the policy is almost ready, and we have discussed this with all the counties. We have actually gone to all the counties, and we've done county consultations directly with all the stakeholders within the counties, the youth, the parents, the administration, the religious leaders, the social leaders, focus group discussion. And so I think that policy has taken its route. The other one, the FGM register, we have a guideline and we have a policy of eradication of medicalized FGM at least by 2022. December is ending and we are not reaching there. So having a register in the hospital means that we are agreeing or allowing them to be done in the health facility. We don't have registers, but we have mechanisms, a multi-stakeholder mechanism where the county commissioners are the lead. We also have an anti-FGM board, which is oversighting and advocating for this. This is a very serious matter. It is one of the ICPD 25 commitment of the president, so it's at presidential level. We may not have registers for it because we are not supposed to even be doing it. But we have structures of collecting data at the community level from the chief through the county commissioner, and we can get the data if you want for all the counties. The issue of nutrition, I can't overemphasize it. Nutrition is the bottom line of our development agenda. The brain development of a child is based on what the child feeds on the first 1,000 days and the nurturing care. And therefore, as a ministry, we have everything that it takes in terms of policy environment, in terms of advocacy, in terms of support. And we have also done a proposal for a flagship project which includes nutrition within the MTP4. The MTP4, and we have been struggling. Yesterday I was in MTF, and we have put in something for commodities. And nutrition commodities is one of the strategic commodities. Thank you.
Thank you very much. Waziri, you can go next. And also put in your final word.
Okay, thank you very much. I'll dive straight to the questions and the issues raised. One of the issues is on the economic blocks. Counties have the options of creating economic blocks. And I think there are several that have come up. With Central Region, we have CEREB, that's an economic block. And I have happened to be the chair of the Council of Ministers in that. Hopefully the gentlemen or the people who have come up on board will take over. The whole idea of getting the economic blocks, one is to pool together resources and possibly also identify key areas that can be done by specific counties. For example, if you are to establish a cancer research center in the mountain region, you don't have to do it everywhere. It can be done in one county. Then you can have an agricultural issue in another county. Like now we are proposing that we have banana processing taking place in Tharaka-Nithi. Another county takes another responsibility, so that you all take advantage of economies of scale. And together now you pool so that you're able now to propel your counties without necessarily injecting a lot of resources as individual counties and having what we would call the draft projects. The revival of the railway line between Nairobi and Nanyuki was done through the effort of the Central Region Economic Bloc. So the Trade Department and the rest of the departments now need to take advantage of that railway line, because it is mainly one company that is taking advantage of that, the Vivo Energy, although they had a big stake in that. So that's an area that needs to be explored. And very soon, I believe, especially for the region block, I mean, central region, you'll be called for that forum so that you are taken through the whole process. The approach this time is specific governance will take lead in various sectors. I think Governor Mudhomi is taking lead in health. Governor Kahiga would be taking lead in something like agriculture. So that's the route, and I believe that we shall move in that line. And we have other regional blocks. The other one is on what we call money bills. When you develop a bill, like the FIF one, what Professor is alluding to, make sure that, and I'm happy that the county attorneys are here, make sure that you develop a bill with its attendant regulations, so that once you submit the documents for approval by the county assembly, you will not be going for the bill and then you go for the regulations. And the safest way of doing this is make your proposal from health and engage with your county attorney, call the finance people, and then hand over the baton to the finance team so that that bill is owned by the finance office. Because it's a money bill, and the law requires that all money bills emanate from the CC finance. So don't struggle so much, and don't keep fighting that my bill did not go through. Get a sitting with the CC finance and the county attorney, and together do this. We are all doing this for the same Kenyan, the same county. So don't try to do your own things or try fighting your colleagues. And don't think that CCM finance are super ministers. That is wrong. It is actually, that is the donkey in the area. Push all the materials there and leave it there and agree and give timelines and keep pushing when the documents are there. So I want to encourage you to develop the bills and regulations, which are, if they are money related or money bills, then give them to the CCM finance. The other one is on wage bill. I think it's critical that we check on our wage bills, because the law says that PFM again talks about not less than 70% is secured for development. Not less than 30%. So you are left with 70%. If you push your wage bill beyond the recommended at 5%, then what that means that it will eat into, you'll pay salaries and wages, then in between you lack money for operations and maintenance. So allowances and commodities, purchase, utility bills, and your allowances will not be factored in. Finally, as I conclude, it's also important that you as CECs know your rights. Like, as per the contract, your medical cover, it's good to know that you're covered. If it is the issues of the benefits, which is basically the car and all the others, and they are taxable because they are benefits, you should know that. Then, unfortunately, I've had some issues from some counties because they are not remitting. They are not remitting gratuity, pension, NHIF, NSSF, and KRA. So all those things are now in a mess in very many counties. So ensure that you start on a clean platter, that all these savings are there and they are for your own good. I just felt I should mention that with your permission, and we are available to give, to be available for free consultation. I wouldn't mind visiting Kisumu and the like. But let us work together as a team. Let us not reinvent the wheel. There are a lot of things to learn from the outgoing CECs. And I want to appreciate Council of Governors in a very special way for organizing this form of an entry and exit forum. We did not go through this before, and we had to wade a lot in the mud. So I would not want people to go through that. We are available, and we shall do our best. Thank you, and God bless.
Well, thank you very much, Waziri. And the resources available. Samora, very quickly, just.
Yeah, so I know there was one question, but I don't think there's enough time to address that. So Vincent, maybe we can take that question offline. I mean, for me, final word to Waziris here is, this is the third generation. There's been a lot of learning that we've had through the different administrations or the different generations of the evolution. Our counties are unique, and each county is very different with different challenges, but from a health perspective, a lot of the challenges are actually similar. So, there's a lot of, there's a wealth of experience amongst the counties, so let's try as much as possible to learn from others. We cannot make the same mistakes that our predecessors have done, so, take advantage of the forums that you have, the caucus, the regional forums, and just share your challenges and your experiences, because what you're struggling with now is very likely that there's somebody in that forum who struggled with that and found a way through it. So just encouraging you to take advantage of that. Thanks.
Thank you very much. And now, Waziri Eda, just your last words.
Thank you. My parting shot, as you go back and sit behind your table on that desk, do not allow the circumstances that you find yourself to define who you are, to discourage you, because you can go back and find so many things that are wrong, and you have been talking to colleagues and you find they are so far ahead of you that you get discouraged. When I came to Mandera, I asked myself 5 days. I even contemplated, do I take up or do I resign after 5 days? But I refuse to be defined. In Mandera, we say we are not going to be defined by the problems that we have. We must have a way coming out of it. Even the other day when Al-Shabaab abducted ambulance plus this crew, we managed to secure the crew and they remained with the ambulance. Now I went to the governor and I told him, look, next year, and right now first we operationalize the theater. 2, next year I'll get a radiology unit as well. We don't refer anything from this sub-county. Let's even cut out these issues of, please don't allow to be defined. 2, there are people who have been there before you with immense experience and knowledge. That chair, you will not be the first person, you are not the last person. There was someone before you, there will be someone who will come after you. Please consult the one who was before you on things that you see is not adding up. No one is an island. Talk to the colleague who was there before you, like you are having an issue, let's say, with human resource. You can ask, what happened here? Then maybe you can get a way out. Finally, and this is the most important, and that's why I kept it last. Please don't be trigger happy. And don't just jump to a conclusion merely because somebody has told you something. Sometimes staff, they come and they tell you X, Y, Z. Dr. Amalwa is like this, he talk like this against you, or he's doing that. X, Y, Z has stolen money A. Take time and digest. If you are the kind of person who immediately you are told, Amalwa, ameiba shilingi moja, you have not even verified. This person who has come to me and telling me something, what is the authenticity? What is the verification? Then you just jump and kill that stuff and you slaughter. That is not management. That will be a crisis. Don't digest and act immediately on things that you have been told and you know nothing about. Research, take time, make your decision. Thank you very much.
Thank you very much, Dr. Let's give a hand to this group. Hand of a clap. So thank you very much. Panelists, you can stand up. You take a group photo. Where was the photographer?
Photographer, please come.
Yes, and as we wind up, I think it was Nelson Mandela who said that the greatest message of a leader is that of being able to come into a meeting with the elders and others and letting everybody speak as you listen, holding your comments, and then speaking last. So I pray that you learn the wisdom of listening as you go forth to do great deeds for our nation. So thank you very much, and God bless you. This session has come to an end. I will welcome Dr. Mutaha Kangu to make a few remarks. So, Prof, you can come and make a few announcements.
You have to hand over the power I gave you.
Okay. You taught me.
Okay. Usiende na power. Now, makofi kwa hawa wangwana. Thank you very much. This was a powerful panel, and I think we have all benefited. So be patient for a short while. I want to call in Chebukati himself, because the returning officer has disappeared with the ballot papers. So please take over and briefly.
Thank you so much. Now, before we go for lunch, just a quick announcement. You were told a few things about the elections we are going to have this afternoon after lunch. The positions that are available, which you need to know, and I think Mabel has already shared to you by way of WhatsApp, is the chair for the caucus, the vice chair for the caucus, then a secretary general. That position of deputy secretary, you should put there stroke whip. The deputy secretary also serves as the whip. And then, of course, there is the position of the treasurer. Then below that are thematic technical committees. Each of the thematic technical committees will also require a chair. And we say that the caucus chair cannot at the same time chair a technical committee, so that room is left to other members to chair thematic technical committees. And members will be free to choose which technical committees they would like to belong to. You could belong up to 2 or 3 technical committees, but for purposes of effectiveness and efficiency, we discourage a member trying to belong to more than 3, because then you will not find time to effectively serve in each of those thematic groups. Now, the thematic technical committees, number 1, we have the Health Care Financing Leadership and Governance Committee. Number 2, we have the Health Products Supply Chain and Infrastructure Committee. Number 4, we have Human Resources for Health Committee. Number 5, we have Service Delivery Quality Assurance and Standards Committee. Number 6, we have Health Information Research and Monitoring and Evaluation. Number 7, we have Intergovernmental Relations Committee. Number 8, we have Welfare Committee. Number 9 is Projects Implementation in all counties, and examples are given there: THS, UCP, Danida, MES committee, and then of course we have a committee on Global Fund, stroke KCM representatives, and so on. And then, of course, members. So as we go for lunch, look through that, decide what you think you want to do for the caucus, and those you have agreed on should be the leaders, you caucus, so that if we agree, it should take us a few minutes and we finish, and then go to other things. Yes, Yumbia. A microphone for Yumbia there.
I'm saying in the spirit of consultation,
yes,
and consensus building, we do not expect ballot papers to be delayed.
Yes.
And therefore my proposal is that we dispense off with the item of elections now,
yes,
so that people can go and have their lunch at their own ease. So this is my proposal. We have consulted with a few of the candidates here, and as you know, I'm contesting for the HR committee. So our thinking is that we just have to finish this.
So that we go for lunch when we are finished.
Yes, that's what
is that
when
what
when we have
think?
a chair.
Those who are for yes, you stand, then maybe we will know. Those who want us to finish before we go for lunch? One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Those who are for no? Okay, the yes have it. So we can finish quickly. Mebo, where is Mebo? So can we begin with the caucus chair position?
I propose Mahmoud.
Who is proposing?
Yumbia is proposing Mahmoud.
Mahmoud who?
For the chair.
Mahmoud Eda.
Yes.
There is a secondment there.
Yes.
Is there another proposal?
No.
Oh, there's no other proposal?
Yes.
So we have the chair, Dr. Mahmoud Eda.
Mahmoud Eda juu. Mahmoud, panda bele. Kwenda huko juu. Eda bele. Wewe mzee, wacha kuingavia na elections.
Aya.
Aende bele sasa.
So we do have a chair, so you can take that memo. We will not change the returns in the servers. So right, Mahmoud Eda, the CEC for Mandera.
Aende bele. Yeye ni mwenyekiti wangu.
You can come here so that you don't realize when we have switched and put someone else there. Now, can we then move to the position of the vice chair?
A lady. We need a lady.
Gender is being mentioned. Okay.
We have received interest from Waziri Ruth Koech from Nandi for the position of vice chair.
No, that is the only name we have received. You are all in agreement. Vice chair, come forward. It should make me Chebukati. I will change these things very quickly. The next position is Secretary General. Let's hear from.
We have received for the nomination to the position of Secretary General request from Dr. Ombati from Nyamira.
No opposition. Unopposed.
Dr. Ombati?
Yes.
Okay, we already have a Secretary General. Hii ni serikali ya haraka pana kuchelewesha watu. Karibu. Then now we have the Deputy Secretary, whom we said also serves as the whip. Any name?
We have received the name of Dr. Andrew Wamalwa for that position of Deputy Secretary General stroke whip. He's there from Bungoma.
Are we in agreement?
Yes.
Thank you so much. So we have Mandera, Nandi, Nyamira, and Bungoma. Good spread. Now we go to the treasurer.
For treasurer, we have a request from CEC Busia, Beatrice, Madam Beatrice.
Are we regional balance? So do you want to propose someone else? Now, what we are saying is that we put out a request that people show interest, and here we only have that interest, but we are not stopping you from, it's elections, so anybody else can be declare or be nominated so that we have 2 or 3 or more people contesting. Who else? We have Beatrice. Yeah. Who else should we consider? Eh? Yes. So you are saying that we support whoever has shown interest?
Yes.
Yes. Dr. Ganda? Yes. They are saying regional balance. Regional balance. We have Rift Valley, Nandi. We have Northeastern Mandera. We have Nyanza, Kisii.
We shall sort
Nene
those other
Nyamira,
issues for committees.
And Wamalwa, Bungoma Western. So whom do we add in this for regional balance? Yeah, let's hear.
I think I have something to say. There are things you don't force people to do, like keep money. So kama mimi ukinipea hiyo pesa sitakubali, hata kama ni maneno ya regional. If we have one person willing to serve, please let's have her serve.
So anybody proposing Beatrice? Eh? She has withdrawn. Eh? Okay. Okay. Eh. Thank you. Eh? So we are satisfied with that decision? Thank you. So then now we go to the thematic committees, the chairs of the thematic committees, healthcare, financing, leadership, and governance. Any requests?
We have not received any request for that position.
Yes. You want to offer yourself or to suggest someone? You are offering yourself. Any other offer? So Apali from Turkana is, we all agree he chairs financing, leadership, and governance, isn't it? So Apali. The next committee is health products, supply chain, and infrastructure. We have
Gifton Mukaya from Taita Taveta.
Mukaya is here from Taita Taveta. Yes. Thank you. Now the next is human resource for health.
We have a request from Dr. Yumbia.
Dr. Yumbia is there. We are okay for him to manage our human resources? Yes. Thank you. Then we do have service delivery, quality assurance, and standards committee.
We've not received any interest in that position.
Nobody has shown interest. Can you show interest now? Okay, that is Dr. Kichuya from Tharaka Nithi. That's good. We are okay? Then we have health information, research, monitoring, and evaluation. Any interest?
We've not received the request today, but from the chat, Dr. Ganda had said he had expressed interest. Dr. Ganda from Kisumu.
Anybody else? Pepela, you are also interested? And Dr. from Elgeyo? So we have 3 people interested in that committee. Now you have to vote. How do we? Can we leave that and then we'll come back to that? We have 3 candidates. We'll, we asked them to go for consensus. So Dr. Pepela, Aganda, and why am I forgetting the name of my good friend here? Kibiwot, yes, Kibiwot. Step aside and talk to each other. We would be happy to do that. So can we go to the next, or we wait for them? Because they might be, you know, some of them might be interested in the next. Okay, we go to the next. Now, the next committee is Intergovernmental Relations Committee. Doctor? Albert Haiti. From Laikipia, yes, Laikipia. Are we okay with that? IGR? So that is done. Then we have Welfare Committee, Maslahi yenu. They are saying a lady will do better welfare for the rest. Who should look after your welfare? Roslyn from, and then this is who? Leah from Claire. We send the 2 of you to go and consult. Go and consult as you also look at the regional balance, okay? Now, they have already agreed. Who should do it? Claire. So Claire is there for welfare. Yes. Then we have projects implementation in all counties. We have, and who is that? Kericho, Garissa, Kajiado. Aya. Wacha tuwapeleke nyuma ya tent. Musungumuze mutupatie majibu. Please, the 3 of you go talk. And then now we come to this global fund. Is it 1 person or?
We need 3.
Yeah.
We need 3. So let me just explain.
Okay, fine.
So in the global fund, we need 3 county representatives in the KCM. We need 3 representatives from the county governments in the KCM. And
colleagues, I have just stood up to emphasize something on this KCM. The global fund is where there's a lot of money that is coming from up. It has got a lot of partners. The PS Ministry of Health is the chair. It requires, first of all, your presence, whether that is virtual attendance or physical attendance. So this team that we are going to choose must be people who are going to be very seriously attending those meetings. That's the only thing that I want to say. It's a very important body. Thank you.
Thank you. So we want 3 members, and these ones will be representatives to that committee. It's okay. Yeah. Okay. So, Kilifi, are we okay with 1 member from Kilifi? The name? Kilifi. The second? Baringo. Which one? Is this one or the one behind? Baringo. Are we okay with Baringo? So Ahmed has withdrawn from the other one. So do you want to be a member of KCM? And then you have withdrawn? Because of gender. So what do we do? Do we have... we have Embu, Kilifi, Kajiado, Garissa, Baringo. How many people? We have 5. We need 3. Can we ask the 5 of you to go and consult and give us 3 names? Kajiado ametoka? Amechoka kutoka? Wakajiado wawekwe kwanza? No, just go. They have heard. We are sure they will look at that. Give us the 3 names. So the ones that we had sent out, information and research, what did you settle on? Who will report for us? Dr. Ganda? They said we bring it back here. The 3 of you. Okay, so we will vote after the others come. Then the other one was
we sent Kericho, Garissa, and Kajiado.
Projects. We had sent Kericho, Garissa, and Kajiado. What did you agree on? Kericho.
That's all. Then we have sent again the 3 to get members for the KCM.
Yes. So a few minutes we need to finish so that. HIS, yeah. Okay, fine. Jemima, we need ballot papers for the position of information, health information. Quickly, prepare some quick papers there. Wale wa KCM haraka haraka. Okay.
Immediately we finish, Katra wants to go. We give her to say a few things. Then I don't know whether we begin with you to make an acceptance, and then we call Moga to hand over. I think that would be okay.
They should have picked guys around the Nairobi. Kajiado is okay.
Ombali, they might not be. But anyway, let's hear what they bring. But those are some of the factors you need to. Wacha tumalize tu. Oh, okay. Do we have Mumemaliza? So we should, you have that? Okay. So Global Fund Kilifi, Garissa, and Kajiado. Now, No, those ones we had filled. Oh, you had withdrawn.
It is only one person.
That-
Now we already have Kericho.
No, that was a committee.
It's one committee. There were 3 people, but you gave us Kericho already.
The one of 3 members is KCA. Yeah? Yeah. Yeah, we are distributing ballots for the chair of the health information, and the candidates we have are Dr. Ganda from Kisumu, and Pepela from Trans Nzoia, and who was the third one? Kibiwot from Elgeyo Marakwet. So the paper you get, quickly write, you just write the county, you don't even have to write the name. We have Trans Nzoia, Kisumu, and Elgeyo Marakwet. Trans Nzoia, Kisumu, and Elgeyo Marakwet. We quickly pick that so that we can finalize and yeah, they bring the paper, the votes here. Yeah, the ballot papers will not be beyond 47, but of course, yeah, it's only for the CCs, not former CCs. The current CCs are electing their own colleagues. We are saying the candidates are from Kisumu, Trans Nzoia, and Elgeyo Marakwet. So you pick one of them. You pick from those 3. Dr. Pepela, Dr. Ganda, and Dr. Kibiwot. Wangejitetea? No, we don't want to campaign on the voting day. We close the campaign time. Quickly bring those that you have, because we have to finish this. Jemima, come and take these ones. Take these ones also, up here. Pick these ones also. Have all the votes been returned? Anybody still has the votes there? No. So we have all of them. Quick counting here in open. Here. Yeah. Read out the votes there. So much. Peana huku.
Kisumu. No, Uasin Gishu, sorry. Elgeyo Marakwet. Kisumu. Dr. Ganda. Okay. Elgeyo Marakwet. Elgeyo Marakwet. Elgeyo Marakwet. Kisumu, Dr. Ganda. Pepela Wanjala, Trans Nzoia. Kisumu. Dr. Ganda, Kisumu. Elgeyo Marakwet. Trans Nzoia. Trans Nzoia. Elgeyo Marakwet. Elgeyo Marakwet. Kisumu. 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 Elgeyo Marakwet. Kisumu. Kisumu. Kisumu City. Trans Nzoia. Elgeyo Marakwet. Kisumu. Last but not least, Kisumu City.
So can you count Trans Nzoia?
For Uasin Gishu, we have only one. One was in Gishu.
One was in
Oh, you need
Gishu.
to turn it upside down so that you can see there is nothing remaining there. So
For Uasin Gishu, we only have one.
one was in Gishu.
For Trans Nzoia, it's
One.
Oh.
So that one is spoiled. Okay.
One, two, three, four, five.
We've got 5 for Trans Nzoia County. Elgeyo Marakwet.
1, 2, 3, 4, 5, 6, 7, 8, 9.
9, Elgeyo Marakwet. Kisumu. We're two, Papa.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18.
18, Kisumu has it.
You have spoken your minds. So Dr. Ganda is for the Information Systems Committee. So that has finished with us, and I know our director is in a hurry to go somewhere, so I would like to invite her to make some remarks since we have finished the exercise. Then we will follow up with the remarks. Yeah, as she takes, she will need to be there. As she finishes her remarks, we take a photo so that we release her. After her remarks, we will invite the newly elected chair to make his acceptance speech, and then we finalize with the outgoing chair to make the handing over remarks. Thank you, Director.
Thank you very much, Prof, for that wonderful exercise. It is only legal who can manage this exercise. For us, we step aside. Hatutaki kuambiwa, ilikuwa hivi, ilikuwa hivi. Then when they go to court, they can defend themselves. For me, I'll actually time myself. So I want really to take this opportunity again because of time. We said they just hold on our lunch up to 2:30. There's a lot of pressure also from the kitchen. But I really want to take this opportunity to thank each and every one of you for the successful induction for the 3 days. Without your commitment, it will have not happened. But with your commitment, it has happened. And I believe now from this, at least, we have enriched you with a lot of information. I know it was too much information, but we said we are going to repackage this information into manuals. You have a reference manual, and you also have a abridged version. In your booklet, you also have high-level policy and legislation barrier resolutions from that. So once again, nimeshukuru sana. This looks very committed. As I told you earlier, you also have very committed health committee members of governors. So you will be working closely together, and I know we can be able to go to another milestone. So I really want again to take this opportunity to thank each and every one of you. To the elected leaders, you have a responsibility. You have a responsibility, and if you are given a task, you must deliver. If you, the CCs who are seated here have entrusted you with this position, you have to deliver, and you have to meet their expectation. So how we are going to do it, as we don't know. What we just want is for them to, so you want them to deliver. And this election, as you are told, it is after 1 year. So if you extremely do well, you may retain for your seat maybe in another year. If you don't, you'll just pave the way. So make sure you hold on that. It's not 5 years, it is just 1 year. To the leaders who have been elected for the thematic committee, that is a challenge that we had even previously and even before then. Please commit yourself to that thematic committee. Technical thematic committee is very critical. You have a co-chair from the Ministry of Health, or you chair, you co-chair with MOH. So at any one time, sometimes you find we are just endorsing what only MOH did. Our technical person who was co-chairing is missing. So please commit yourself. Make sure you are very active. The resolutions from that, actually when we sit in IGF, Intergovernmental Forum, whatsoever is going to be presented there is what was agreed upon by the chair and the co-chair. So if you miss out what we are going to take from MOH, but at the end of the day, we are just going to blame. The blame will be on you because you have promised to be in that to be chairing or co-chairing that particular committee. So we want your commitment, and please let us work together. We don't need to call and tell you, please, join. No. For the KCM, Kenya Coordinating Mechanism, remember, this is global fund that support HIV, TB, and malaria. And this money comes through principal recipient, AMREF, and Kenya Red Cross. It is always chaired, the KCM is chaired by the PS Health. We are going to tell you more about this. We have a forum to just enlighten you what really happens. But please, commit yourself, never miss out of that meeting. It's a very intense meeting. You'll be seeing emails all over. Please make sure you don't miss out of that. To our facilitators, our moderators, Professor Rukwaro has actually sat in. Prof, tusimama tukupigie makofi. Mpigieni Prof makofi. We are not taking this for granted, and we really appreciate you. We celebrate you, and we say thank you very much for the good words that you have given us. MOH who are here, kindly stand up. MOH representative, Dr. Kibor is actually is in the intergovernmental, in the partnership coordination framework. At any one time, I'll share his contact. Please reach out to him, and we also say we celebrate you. Our rapporteurs, just stand up. In the next 1 week, you will have your report. We always have a signed report that is also, we are going to share a draft. We improve on it, we share. Our outgoing CCs who are here with us, please stand. We are not taking this for granted. We really celebrate you. Tunasema asanteni sana. And please, anytime we call upon you, anytime we want to consult you, be available for us. We really celebrate you. To our secretariats, it was not easy. For us to reach this journey, it was not easy. We started this journey in March last year, trying to put things together, trying to put things. These manuals you are seeing were developed by the secretariats. But with the help of the caucuses, the directors, the chief officers, the CECs, we were able to bring this and make it so beautiful. Simuliona, it is not a consultant who done that. with the effort and with the support from also our chair of health committee, the secretariats managed it. I want you to see them. They are seated behind there. Any secretariat who is seated anywhere, let you be seen. Just stand up, stand up. Those guys are very, very wonderful, very wonderful. At any one time, still stand up. You are part of us. These are a wonderful team, and these are the teams that are going to work closely with you. If Katra is not there, they are also there. So please reach out to them. Very rich with information, guidance, and anything. To our sound team, simameni tu museme asanteni. Tuambie asante. They also did wonderful. This work we are seeing here, tulifanya mpaka 2 a.m. to the meeting. So tumeshukuru sana to the management of the hotel. We really appreciate. This is a good conference room, right? At least we've not congested you in a small room. So I want again to take this opportunity to thank all of you waziris who are seated here. Clap for yourself. Tumesema asante sana. I know the next 5 years we have a mile. We have miles to travel. So thank you very much. At this juncture, I want to hand over to the new chair. You wanted to say something? You cannot? I wanted to hand over to the new chair to give his speech. And what is it? But he has to be very, because the hotel are also pressurizing us. After that, we take a group photo. We'll be close with a word of prayer. Thank you. Okay.
Colleagues, I want to take this chance to propose a vote of thanks to this strong lady, a very good coordinator. We worked with her in the last 5 years, and she's doing many things at the same time. You can see the success here. Can we give her a clap? I am talking as outgoing chair, so I know we have worked. Thank you very much. And then before we invite the new chair, let me thank our IEBC returning officer. Can you clap for him? Let me take this chance to welcome this new team. And let me reveal to you that Dr. Eda was my vice chair. And remember, he's in Mandera. And he would come to all the meetings. Sometimes I would wonder how he's making it. And he's a very successful minister in Mandera. So I want humbly, and I want to invite Esther to come here. Esther was our treasurer, and she was collecting all the money. If we lost somebody, a relative died, she would collect all the money and make sure that the money is taken to the funeral. She's the only one who is here. So I want me and her, we hand over to you. I was asking Mabel, where is the instrument of power to hand over to Dr. Eda? Please stand, and your team. But we want to say that you put your hand here. Come and hold here. Come, Dr. We want to say that we are blessing all of you and wishing you all the best, that you can take this thing to another higher level. Okay? Now you can make your maiden speech. Thank you.
Thank you so much. Isaac Newton once said, if I am ever called a great because of inventing a lot of things in physics, it was only because I stood on the shoulders of men and women who are taller than me, who are there before me. So may I humbly, first and foremost, recognize those who were there before us, Professor Richard Muga, Professor Mwanje, and my colleague whom we have been together in the second generation, Madam Esther, doubling up as now KEMSA. I take this opportunity to recognize you and thank you very much for mentoring us. This is by no means the last interactions between you and us. We will keep withdrawing from the bank of knowledge that you have. May I also take this opportunity to recognize the men and women in the COG Secretariat. I think this is the only secretariat of its kind. Can we give them a standing ovation? Standing ovation, please. And we clap for them. You have seen what they have developed in terms of manual. Thank you so much. You can take a seat. In terms of every good thing that we have done, Tadra and your team, I want to assure you the highest cooperation and consultation and collaboration between the COG Secretariat and the leadership of the CEC's caucus and the entire CECs for the period that we'll be leading them. My colleagues, I take this opportunity to immensely thank you so much for the confidence that you have had by giving me this opportunity. I am now a leader for all of you. There should be no perception that by being the chair, I will get or I will lobby for any resource for Mandera at the expense of any other county. That is not me. If we are going to get something, it belongs to all of us. If I see there's my brother and sister somewhere that requires all our collective help, all that help is going to go to that CEC in that county for that particular reason. And therefore, I want to assure you of my utmost cooperation, my utmost dedication to this cause. I am a passionate fighter for devolution, and we have got a very good environment currently. We nurture. We are going to develop a few minimum deliverables for my team. We will consult, and we will develop some very minimal deliverables for this year to make sure that those ones on the very least, even if we cannot achieve everything that we'll come up with, then we achieve these ones. Because we have to go together in this channel. And we are going to share with you what are the minimum deliverables for this team so that then we have your concurrence. We will not do anything without consultation. We will not make any decisions that has not been consultatively agreed on between all of us. Sometimes, just like you have seen in the case of democratic process where we were electing the health information and technology, we may have one or two, differing opinions, but at the end of the day, the majority decision carries the way. So I want to assure you, all the CECs, that we will not make decisions that we have not consulted you. We are not going to make decisions that have not been consulted together with our Council of Governors, a decision that we have not shared and thought about it together with the Secretariat, so that then together we all go forward. Ours, me and my brothers here and all of you, the next few months that we are going to be there, or whatever opportunity God grants, we want to make sure that we collaborate with our partners, with the National Ministry of Health, because this is one Kenya for all of us. So thank you so much. God bless you. As you go back, we are going to take all these responsibilities immensely. For the chairs of the subcommittees, I want to say that actually the oil that runs this vehicle is the subcommittee chairs and the subcommittee teams. So we have only chosen the chairs. Each one of us, every CEC must belong to one committee that you are capable of, you have got some technical knowledge, that you have got the passion for. That will come at its own time. We are going to go, have another meeting, maybe whether that is virtual, most likely maybe virtual, to choose those committees. That will keep us going. Thank you so much to my colleagues here. All of you, congratulations again. And we will never let this team down as long as we are in this office. Thank you so much, and God bless you all.
Thank you very much. Group photo. Group photo, cameraman, maybe the caucus. You take your photo, and then you take one photo with all the CCs, and then with the Secretariat.